Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower anterior region. Starting with the lower right canine region, as you can see, we've got an extremely thin ridge, only ridge width of approximately 3.9 millimeters and a height of 14 millimeters. Now, this ridge will need bone augmentation prior to implant placement. This is the lateral incisor region. Again, very thin ridge, just 3 millimeters of ridge width with 14 millimeters of height. And then this is the central region, even more thin ridge, just 2 millimeters of ridge width. Moving to the lower left, again, very thin ridge. And then the lower left canine region, again extremely thin ridge. So this area will need bone augmentation or alveoloplasty of approximately 6 millimeters or 7 millimeters prior to implant placement. Then we will have approximately 6, and this is throughout the lower anterior region. Now if you move towards the lower posterior region, this is a lower left 6, very severely infected, periodontal infection with periapical uh, radiolucencies. If this tooth is extracted, we've got a ridge width of 8 millimeters and a height of approximately 13 millimeters. So implant placement here will definitely be possible. The upper left segment, this is the upper left 6 region, ridge width of 9 millimeters and a height of approximately 7 millimeters. Now this is the 4 and the 5 region. This region can support an implant, 8 millimeters of ridge width and 13 millimeters of height, periapical radiolucency around the 5. This is the 4, again severe periapical radiolucency. If this tooth is extracted, we've got a ridge width of 7 millimeters and a height of approximately 16 millimeters. The upper left lateral is also missing. This also has very thin ridge. The upper right first premolar is a PDR, endodontically treated, no radiolucency, 7 millimeters of width with approximately 14 millimeters of height. And then you've got the upper right 5 region, good bone, 6 millimeters of width with approximately 10 millimeters of height. And then we've got the upper right 6 region, good bone, 8 millimeters of width with approximately 6 millimeters of height. The lower right 6 region again is the edentulous, thinner ridge than the left side, but you've got approximately 6 millimeters of ridge width with approximately 12 millimeters of height. And this is the most ideal implant placements. All the regions where implant is possible, we've placed it. The areas where we haven't, implant placement is not possible with the current bone scenario.